doing? Fantastic. And you're here for your cranial nerve exam for your ears, nose, and throat today? Perfect. Okay. Well, let's just jump right into the appointment. I know you said you were in a little bit of a rush today. Yeah, no problem at all. Yeah, we'll get right started. So first, I'm just going to start by listening to your heartbeat as well as your breathing, okay? Just to make sure everything's okay there. I always like to start each appointment with this. Just a basic telling to make sure everything's okay in there. All right, if you can just take a deep breath in for me and let it out. Okay, perfect. Sounds good. And just on this side. And take a deep breath in for me. And breathe out. Okay, perfect. Everything sounds wonderful in there with your heartbeat as well as your breathing. Okay, and I think we're going to first start off with ears, okay? We're going to do a few tests. Okay, so first we're going to use this brush here. And I'm just going to put it up to each of your ears and just make gentle brush sounds. Okay. Very straightforward. And can you hear it on this side? Good, okay. And what about this side here? Okay, good, you can hear it. Perfect. So what I'd like for you to do is I'm going to do that again, but I'd like for you to tell me when the brushing sound stops. Okay? When does the sound stop? Okay? Tell me as soon as you hear it. Stopping. Are you ready? Okay. Let's do this. So we're going to come up to the one ear here. Very good. And now just on this side. Very good. And we're going to do one more on each side, okay? And here we are. Very good. And just again on this side. Excellent. Perfect. So you could hear when those both sounds stopped immediately. so there's no issue there. But we are going to do a couple more tests for the hearing just to make sure everything's okay, all right? And that everything's working functionally within your ears. So now we're going to be using the brush again, but we are going to be using the back of it this time. And we're going to be using this little stick right here to make much more sharper sounds, okay? Just so we can get the level of decibels on every spectrum, okay? So, similar to the other one, I'm going to start on each side and just tapping just to see if you can hear the tapping. If everything's good with that. And then we'll move on like we did in the other one. Perfect. So you're ready? Fantastic. Here we go. Now tell me if you can hear this. Perfect. And on this side here. Perfect. You can hear that as well. All right. Now that we've covered that, we're going to move on. And again, like with the last one, you will just let me know when the tapping stops, okay? Perfect. Starting on this side here. Very good. And just on this side as well. Excellent. So again, you had no issues there determining when the sound was going to stop. So I am liking the results of that, but I would still like to do just one last test, just so that we're covering the full spectrum of the volume decibels, okay? Now in this one, I'll be doing whispers. So we've gotten the high end of the volume, we've gotten that mid-low area, and now we're moving on to the very, 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 very low decibel, okay? So with this one, like I'm doing right now, I'm going to be whispering into each of your ears, okay? And I'd like you to repeat back the words or phrase that you hear from me, okay? Okay, very good. Now, just like in the first test, we're going to start with just a simple, can you hear me on each side, okay? So I'm going to come over to your ear here and whisper a word or phrase, okay? Relaxation station. Very good, very good. ASMR. Very good, very good. Okay. Now for this one, it'll be a little bit different. I am going to be whispering at a higher whisper, and then a lower whisper, and then an even lower whisper. so that we can determine if you're able to pick up sounds at that lower decibel, okay? Fantastic, okay. So I'm going to start on this ear and just repeat back the word you say to me, okay? That word that I say to you, or phrase, okay? Dreaming. Okay, and now tell me if you can hear it at this lower one. Dreaming. Okay, and what about this one? You couldn't quite make out that one? Okay, that's fairly normal. So that's alright. And now we'll do the same on this side, okay? Tingles. Okay, good. Tingles. Very good, very good. And oh, you did hear it, that last one on that one. Very good. So it seems like that ear is a little bit more heightened than the other ear, okay? But that's okay. Usually that's how it kind of goes. All right, so I'm going to do one more round of those, okay? Just to kind of get a full basis with your ears, because I'm pretty sure I have a good suspicion that your ears are in perfect working order. Fantastic, okay. So let's just do this last round here, okay? I'm going to whisper a word to you, okay? Sleepy. Okay, good. And sleepy. Very good. And sleepy. Okay, perfect. And just again on the other side here, all right? Say one word here. Tingles. Good, good. Tingles. Good, and the last one. Tingles. Perfect, okay. So you heard that last one on that side again. Well, that's perfect. So we will move on to the nose now, okay? And we'll take a look into 2 tests that we have planned for that one, okay? And then we'll follow up with the throat test as well, okay? All right, let's get started. First things first, we're going to be doing a smell test with this little dropper here, okay? Now, there are several different scents in here. I believe, let's see, label 4. There are 4 flavors in this little jar, okay? Each section of the jar has a different scent area, okay? So we're first going to start with this one. Okay, I'll go here. Okay, here we go. Just make sure it's all dropped off here. And I'm just going to drop this, okay, right in front of you, and you will smell a certain scent. Can you tell me what that scent is? Yes, that is correct. Kind of like a machine oily smell. Okay, and the next compartment here. Here we go. Oh, need a little bit more than that. Okay, and again, you will smell a scent as soon as they start dropping. Very good, very good. And can you tell me what that scent is? Very good. Yes, bananas. That is correct. Okay, and we'll go into the third section here. Make sure we get some of that flavor in the syringe here. Okay, and again, once they start dropping, take a sniff in. Very good. And can you tell me what this scent is? Yes, very good, very good. That is Cheetos. Okay, and we are on the last one, the fourth and final scent here. Okay. Okay. And once they drop, inhale. Very good, very good, very good. And can you tell me what that scent is, what that final scent is? Yes, you are correct. Dryer sheets. That is fantastic. Everything is working very well with your scent drives. But now we are going to go into a few more scents in a different way, though. We have some scratch and sniff cards here. So we will be taking the brush and unlocking a scent. Now these scents are a little bit different from the first ones, okay? They are a little more robust. They are very powerful, which is why we can't have them in a liquid form like that, because as soon as you take off the lid, the smell is overwhelming. And if you do that, it kind of blocks out the other scents, and they all kind of make one scent, and you really want them to stay separate. So within these ones, we have them installed in cards. So that we can better control the smell. Okay? Now, they're not unpleasant in any way, shape, or form. So there's nothing to worry about there. They're just very powerful. Alright, let's get started with this. So now they do require a bit of a scratch, so you may start to smell it, so you can get an idea before I actually put the card up to your nose. Perfect. Alright, let's get started. Alright, and if you might have an idea already, but give it a good whiff. Yes, very strong. And can you tell me what that scent is? Yes, cinnamon. You are correct. A very strong cinnamon. And let's move on to the next one. Looks like we have 3 cards in total, okay, for this test. So here is the second one. Can you tell me what this smells like? Yes, a very powerful orange smell. Great job. And we will grab the third and final scent here. Is the final scent. That is correct. That was a tough one, but you got it. Cilantro, yes. A very, very powerful herb. So it looks like everything is in working order with your scent as well as your nose, okay? And while you were doing that, I had a look around and examined, as well as I did with your ears, as well as I will do with your throat. As while the tests are going on, I'm looking for certain indications and keys that are sticking out to me that don't really go with the normal parameters of our ears, nose, and throat, okay? And from what I've seen, your nose seems to be perfectly working order. Everything, the movements, the techniques, everything. I'm not seeing any abnormalities whatsoever. So that's what we always want to see, which is fantastic. But yes, everything's looking great for those two so far. So I will continue to examine as I continue with the throat tests, okay? Perfect. I just wanted to give you a heads up that you're doing excellent. Okay, and for the throat tests, we are going to be starting off with a taste testing, okay? Now, very much like the little jar with the scents, this tube contains 4 different tastes for you to taste, okay? And they are all pleasant, don't worry. Just gonna make sure we shake it up properly before we start the tests, okay? Here is the first test. Now, if you'll just stick out your tongue for me, okay? And I will do a few spurts, kind of like this, just to give you an example, okay? Just like that, okay? Just so you know what you're expecting. All right, and stick your tongue out. And can you tell me what that tastes like? Yes, that is correct. Cherries. Very good, very good. Okay, we put the cap back on. Just maneuver it into the next section here. And then just to filter out the tube from the last taste. And now, it's ready for the next one. And if you'll just stick out your tongue. Perfect. And what does this taste like? Yes, very, very good. It tastes like grapes. Like grapes. Very good. Yes, they are. These ones are all on the sweeter side, I'll say. I don't want to give anything away. Give it a good shake there, and then we're going to take off this cap here and slide it into the next section. Okay, here we are. And we're going to just spray it to clear out the spray tube for the new flavor. And if you can tell me, stick out your tongue, what flavor this is. Yes, you are correct. Lime. That one was lime. I sense you're seeing a theme here. Okay, and we're just going to put the tube into the 4th section here now, okay? Okay, very good, very good. And we're just going to shake it up. And we are going to filter out the tube for the last time here. Okay, and if you can stick out your tongue and tell me what this tastes like. That is correct. Mango is the last one. And yes, it was all fruit related. So everything looks wonderful with your taste buds itself. We know that the tongue isn't actually necessarily in the throat, but we do like to test it because it does reach further back into the throat. And if there's any issues going up on the front, we can most likely tell if there's anything happening within the throat as well, okay? Perfect. Now, we are just going to move on to the second test. There are 3 in total for this one, okay? And for this, it is just essentially some swallowing exercises, just so I can see if everything is going correctly when you do take a swallow, okay? So now I'm just going to have you lift your head back gently. Perfect. And I just want you to just simply take a gulp, okay? That way I'm able to determine if everything's okay. Very good. Okay, yep. Very good. Everything looks good there. Okay. And just take another one. Perfect. Okay. Everything seems to be working in order. Do you feel any pain or resistance when you have it so far back and you're swallowing? No? Okay, good. Just trying to get determination here. Looks like you have one little lymph node that's a little bit swollen here, but that's okay. Did you just recently get over a cold or anything like that? Oh, okay, yes, then that would most likely do it. So that is all in working order here, okay? And if you'll just take one more gulp for me. Okay. Okay, yeah, everything's looking fantastic in that regard. There's nothing out of the ordinary besides that little bit of inflammation I saw, but from that is totally normal from after having a cold, okay? So everything's looking good with that. So it leads me to proceed that we can move on to the very last test for this one, which kind of involves both the gulping and as well as a taste. I'm sure you've done this before, but it's one of those open and say ah, okay? So I'm going to put this little piece of wood just to compress down your tongue, just so I can take a little bit more examination into the inner workings of the throat, because everything outside looks fantastic, okay? Okay, perfect. So if I can just get you to say ah. Okay, everything looks completely fine in there. Like I said, there is a slight redness, but again, that's not uncommon for someone who just got over a cold, and with the little bit of inflammation in the neck I saw on the outer, it makes sense, and I was expecting that as a possibility. But everything else is looking fantastic. The uvula at the back is looking healthy, a little bit redder, but like I said, that should clear up in a day or two. Yes, so everything's looking wonderful, and I think we are at the end of the appointment, and I think, looking at the time correctly, we're going to get you out of here just in time for when you need it to be. That is wonderful. Well, I'm glad everything is perfect with that. Please come in for your next checkup whenever you're feeling anything come up, any worry, any stress, any anxiety. Just come to Dr.Relaxa, and I will take care of you. Okay, perfect. The nurse will be in just to give you your belongings, and then you can see yourself out. Fantastic. Thank you so much, and I will see you next time. Take care and stay safe.